So in this presentation, we're going to talk a little bit about pulse and blood pressure. The circulatory system has some really good videos that I'd like you to watch, even in addition to this one. You can find them here both on YouTube, and they look at the electrical aspect of the heart. So you just get an idea, an overview of things before getting into finding your pulse and understanding blood pressure. So your pulse is very important because it's the measure of your heart rate in a minute. You count it. You count how many times you feel your pulse in 1 minute, and you can determine what your heart rate is. There's two commonly used pulse points. One is in the neck, known as the carotid artery, and the other is in the wrist, known as the radial artery. So you want to find the artery, and if you're using the radial artery, you will start feeling, if you would think about the radial arteries in the wrist, and if you were to touch the outside of your thumb and kind of follow it down into your wrist and kind of move your fingers back and forth, you will feel a couple of tendons. Well, in the groove of those tendons, you'll find the radial artery. So that is something that you can use using your pointer finger and middle finger. Don't press down too hard, because if you're taking someone else's pulse, you might feel your own, and don't use your own thumb. So try that. Here's a picture of it. And if you just follow from this part of your thumb down, and you can kind of come in between, there are tendons in between this artery. Just feel that groove and press on the artery, and you should find your radial artery. You can also do that by palpating the carotid artery, and that could be from either side of the neck, and it's just under the jawline next to the windpipe, and you'll find it in that groove too, next to the muscle in between. You'll find that groove in between the muscle of your neck, and that's the sternocleidomastoid muscle, and the windpipe. And again, you don't want to press too hard, and you want to make sure that you are not pressing both sides at the same time, as that could cause you to pass out. You want to think about what's normal for a heart rate, and for adults, anywhere between 60 and 100 is normal. Children, toddlers, newborns, it's different. It goes up. And with adults, if it's lower than 60, it could be known as bradycardia, and if it's greater than 100, it is known as tachycardia. And same for children, toddlers, and newborns if it goes outside the parameters. So here's a great picture showing you all the different pulse points in the body. In addition to the radial and the carotid, which are the most common, you can palpate the femoral artery in the groin, or the brachial artery in the arm, and the posterior tibial artery on the inside of the ankle, and the dorsalis pedis artery on top of the foot. Knowing different pulse points is very important, because this allows you to determine if the body is having perfusion, meaning blood is flowing, and it helps you better assess a situation to help someone. Here is a video that can actually corroborate and further elaborate on those pulse points, so please watch that as well. Once you've found your pulse, depending on the site you're using, count the number of beats over a period of time, and you can do that by counting fully for 60 seconds, and then you'll know exactly what your heart rate is, but that takes too long. You can count for 30 seconds and multiply that number by 2. Count for 15 seconds and multiply that number by 4. For example, 18 beats for 15 seconds, take 18 multiplied by 4, and your heart rate is 72 beats per minute. You can also do 6 seconds and multiply by 10, and that's the fastest and easiest. With regard to blood pressure, that's another thing that's very important to determine vital signs, in addition to the pulse, is the pressure, which is the force of blood that's exerted against the arterial walls. There are two numbers you look at, the systolic blood pressure and the diastolic. The systolic is what the heart's doing when it's contracting and working, and the diastolic is the heart when it rests in between those contractions. So top number is the systolic, and the bottom number is the diastolic. So when you hear a number of 110 over 70, 110 is the heart at work as it contracts. It's the top number. Diastolic of 70 is the bottom number when the heart's at rest. With respiration, we have touched on this in the respiratory part of the anatomy, human body chapter, and we want to think of understanding that range. So if a child or an infant or an adult is having difficulty breathing, we know that the ranges are normal for adult between 12 and 20. So make sure that you are practicing this And understanding these pulse points and being able to know where they are on the body and get familiar with blood pressure, as these things are very important in assessing a scene and assessing a victim.